All right, guys, welcome back to Underground Science. In this video, we'll be talking about drug-induced lupus, okay? So it's going to be a relatively quick video because we're just going to talk about the drugs involved, right? So the name says what it is, right? It's lupus induced by drugs, okay? So certain findings that we should be familiar with. We should be familiar with certain antibodies that you can see in drug-induced lupus, okay? That can give you a clue. So in drug-induced lupus, you can be positive for antihistone antibodies. Okay, so these patients can have antihistone antibodies and positive ANA. Okay, just like we saw in normal lupus, right? SLE. But in SLE, we saw renal and CNS involvement. However, in drug-induced lupus, there is no renal and CNS involvement. Okay, so it's not as severe as a normal SLE. But you do still see your arthritis symptoms, fever, and all that, right? Fever, weight loss, fatigue, and serositis, right? So it can affect your pleura, right? Leading to pleuritis and pleural effusion. It can affect your pericardial layers, right? Leading to pericarditis and maybe pericardial effusion and so on, right? So you can still see arthritis, fever, serositis, and like you would see in SLE. But the only difference is in drug-induced lupus, you don't see renal involvement or CNS involvement, okay? You're positive for antihistone antibodies and positive for ANA too, okay, in drug-induced lupus. All right, but it's called drug-induced lupus, right? So we should see what drugs induce this lupus, right? So the common drugs that we should know, right? I remember by the mnemonic is SHIP, okay? So if you remember the mnemonic SHIP, it's easy to remember because then you can remember, okay, S for sulfa drugs, H for hydralazine, I for isoniazid, P for procainamide, which is an antiarrhythmic, and the other P for phenytoin, which is an anti-seizure drug, okay? You can also use isoniazid in tuberculosis treatment too, all right? So this was a basic quick video, right? It was just focusing on the main things, which is what antibodies do you see? Antihistone and ANA, right? What symptoms do you see? It's similar to SLE, except no renal and CNS involvement, okay? And then what drugs induce this? What drugs cause drug-induced lupus? Remember the mnemonic SHIP, SHIPP, S for sulfa drugs, H for hydralazine, I for isoniazid, P for procainamide, and the other P for phenytoin, okay? So that's basically drug-induced lupus. It was a short video. I hope this video made sense. Thank you for watching. See you guys in my future videos.